This lecture deals with professional ethical codes, looking at some of the codes that other professions use in the counseling arena and comparing them to so-called Christian codes to see the similarities and differences. The appendix to Sanders' book gives us opportunity to review several of these codes for the counseling professions, as well as comparing them to two major codes for pastoral counselors. In recent years, there has been a proliferation of counselors claiming to be Christian in their approach. This raises the whole issue of what it means to be a Christian counselor, and if there is really any difference between Christian counselors and other counselors. In trying to define what is a Christian counselor, some would say there is no distinction, it's merely a Christian who counsels. Others would define the Christian counselor as one who omits certain non-Christian practices from his or her practice, one who refuses to use certain techniques and takes certain stances toward controversial issues in counseling. Others would define the Christian counselor as one who includes intentionally certain Christian practices, such as scripture and prayer and other strictly Christian methodologies. The answer we give to that question helps us determine the relative value of specific codes for Christian counselors. A code of ethics fits well with the Christian faith for two reasons. Christians are accustomed to upholding ethical standards for behavior. And secondly, Christians are familiar with the idea of discipline for infractions of those standards. Any code has its limitations, however. First of all, no code can cover every aspect of human misbehavior. We cannot make a law against every possible misdeed. And so it is in the counseling profession. We tend to develop certain aspects of the code as we find there is need for those aspects. Secondly, these codes must continually evolve as societal expectations change, and so they automatically tend to get longer as more and more areas are defined and added. We want to look at 4 of these professional counseling codes, and the first 2 we're going to examine are so-called Christian codes. The first is that of the American Association of Pastoral Counselors, or the AAPC. This organization deals with pastoral counselors exclusively. The members of the organization must have theological training. They must have ministerial experience. The degree that they hold must be the Master of Divinity or its equivalent. They must hold ordination or licensure with some denomination or Christian movement. They must evidence active involvement in a church or faith community. And this is the one that seems a little bit of an anachronism. They are primarily, but not exclusively, Christian. In other words, they will allow Jewish and other religious groups, members of religious groups, to be a part of the organization. However, the general outlook and the majority of members are Christian. The code of this organization dates to 1994. It begins with several foundational premises: church participation, non-discrimination, the importance of continuing education and collegial relationships. It deals with personal problems that the counselor may face, competence, and professional boundaries. These foundational premises lead to 6 principles. Principles dealing with professional practice, client relationships, confidentiality, supervisee, student, employee relationships, interprofessional relationships, and advertising. Now, as we go through these various codes and examine them, I want you to give attention to the themes that you see recurring over and over again, and I think you'll begin to see the similarities among them. The second group we want to examine is the Christian Association for Psychological Studies, or CAPS as it is sometimes called. This organization is multidisciplinary. It involves counselors, social workers, psychologists, other mental health professionals. It, on the other hand, is strictly Christian. Its code dates from 1993, so about the same era as the AAPC. The Code of CAPS has 11 articles: personal commitment as a Christian, loving concern, confidentiality, competency, personal human limitations, regulations regarding advertising and promotion, research, professional liability, its pastoral care network, membership revocation and restoration, and a general prudential rule that deals with issues not otherwise touched on in the other articles. Next, we move to 2 of the so-called secular codes. The first is that of the American Psychological Association, the APA. The first code of this organization was written in 1953. The current edition dates to 1992. This code has an accompanying casebook that's very helpful in helping practitioners apply the principles of the code to specific situations that they may be facing. This code is long and comprehensive. There are 6 principles to the APA Code of Ethics: competence, integrity, professional and scientific responsibility, respect, concern for welfare of the clients, and social responsibility. There are 8 basic ethical standards that are addressed in the code: general standards, evaluation, assessment, and intervention, those dealing with advertising and public statements, a standard specifically related to therapy, privacy and confidentiality, the issues of training, teaching, supervision, research, and publishing. And because many of these members are often called to testify in court, there is forensic activity. And finally, a section dealing with resolving ethical issues, breaches of ethical conduct. Next, we come to the ACA, or the American Counseling Association. This was formerly known as the American Association for Counseling and Development. The members of this organization are master's degree therapists. The code dates from 1961, nearly as old as that of the APA. And the code consists of 50 items followed by the standards of practice, which set forth the minimum requirements of the code. As we set out to compare the Christian codes with the secular codes, one of the things we note clearly is that both of the secular codes are much longer, many more pages, covering more material in more depth, And they are also much broader, dealing with more professions than perhaps the others do. But we have to remember that these organizations are older and they represent larger bodies of practitioners with broader types of responsibilities. As we compare the secular and Christian codes, we do find that there are 7 common areas of concern that are very important to all of the codes. First of all, do no harm, practice with competence, do not exploit the clients in any way, treat with dignity, protect confidentiality, always act with informed consent, and practice with social equity and justice. Williams did a study comparing the codes from CAPS and AAPC with the APA and ACA codes. And he found that the biggest differences had to do with less mention of duties to the profession in Christian codes. This seems especially concerning considering the ethical breaches that have become more apparent among Christian pastors who are involved in counseling. Maloney did a similar study. In his case, he compared the CAPS and AAPC codes with the APA and the code of the American Association for Marriage and Family Therapy. Maloney discovered 10 areas of similarity among the 4 codes. 1. Primary concern for human welfare, responsibility for human rights of all, responsibility for confidentiality. 4th, a ban on exploitation of any kind. 5th, the need for continuing education. Regulations regarding advertising. Expectations of competency. Issues regarding the acceptance of fees and one's personal interest in receiving fees. Referral, especially when treatment seems not to be making progress. And finally, one's responsibility to other professionals. As we examine them, we find that there are some distinctives of the Christian codes. First, the foundational principles of these codes excel in demonstrating a solid moral foundation based in theology. And secondly, there is a detailed procedure regarding how to deal with ethical breaches of the various Christian codes. There are some challenges, however, surrounding these Christian codes. The first set of challenges involves some inherent problems to almost every code. First of all, there can be uncontrolled growth of the codes. They keep getting larger and larger, leading to more complex regulations, less ability to follow them, and the whole having less significance than if they were limited to fewer principles. There is also a triangulation that often takes place between various groups that the code is attempting to please. In the case of Christian codes, the triangulation is between the obligation to the code, the therapist's duty to the law, and the therapist's duty to his or her own scriptural convictions. There are also challenges regarding omissions in the codes. Some of the areas in which these codes appear to be weak are in dealing with the personal problems of therapists, talking about the inner life of the therapist, giving care to victims of breaches of the code, and the questions surrounding legitimate self-interest for the therapist.